This clinical case is presented by CIVCO Medical Solutions. I am Dr. Lacoursière, Interventional Radiologist, and I am going to present you this clinical case of a long biopsy of a ground glass opacity, which happens to be a bronchioloalveolar carcinoma, and I'm going to be using the RAD-GUIDE device. The patient is a 63 years old man with previous right lobectomy for an adenocarcinoma. He was followed for a very slow growing ground glass opacity of the left upper lobe, and the physician decided to perform a biopsy, so he was referred to us in that context. The CT image shows a very small ground glass opacity in the left upper lobe. After choosing the skin entry point, skin disinfection was performed and the RAD-GUIDE was placed on the patient's skin. A 22 gauge needle, local anesthetic needle, was then inserted within the RAD-GUIDE. In this particular case, the needle was already perfectly aligned with the ground glass opacity. The needle was then moved forward for a deeper local anesthesia, and then it was changed for a guiding needle using the same hole in the top plate, allowing to keep the exact same track towards the target. Finally, a trocar needle was inserted within the guiding needle to perform the biopsy of the ground glass opacity. The sample obtained with this core biopsy was sufficient to perform the diagnosis of a recurrent bronchioloalveolar carcinoma. This case illustrates how a long biopsy can be very quickly performed in a few simple steps using the RAD-GUIDE. So in conclusion, the RAD-GUIDE really supports well the needles. Most of the time you avoid needle repositioning, which is important in long biopsies, and you will not need to hold the needle during CT fluoroscopy, reducing your radiation exposures.